time being a major challenge. That's a very valuable insight there. So thank you so much for that. I'm going to move on now to Dr. Fifa Rahman, the ACT-Accelerator Civil Society Organization Representative. Dr. Rahman, you have the floor.
Thank you, Chair. Vaccines alone cannot take us out of this pandemic. It's clear that we've underinvested in health systems. Last month, we saw 1.3 million doses return to COVAX from the DRC, owing to gaps in leadership, inaccurate assessments on vaccine readiness, and insufficient engagement of local communities. Other countries are also undergoing similar experiences due to the extreme infodemic. Numerous countries have underestimated surge needs, with the starkest example being India. At the last Facilitation Council, we heard the representative from India saying that it was completely self-sufficient on diagnostics, I quote. Yet today there are massive shortages of diagnostics there. This should put all countries on alert. We commend the WHO for developing the COVID-19 essential supplies forecasting tool to help guide countries to better estimate actual needs, and urge countries to use this when applying for funding from all quarters, but especially under upcoming proposals for the Global Fund C19RM. Even where there is supply of COVID technologies, it's important that those technologies be provided through services in a timely fashion and at the right location, particularly to the rural poor. We hear that in Malawi, for example, rapid tests are not allowed at primary care, in contrast to what many global North countries are doing. In a few weeks, the WHO will release updated guidance on tests, and we would encourage countries to build their funding proposals in anticipation of this. Honourable ministers, and notably ministers from donor countries, successful uptake of health technologies depends on a robust health workforce. 17,000 healthcare workers have died due to COVID, and if we continue to underinvest, we will only prolong this pandemic further and increase comorbidities from other diseases. The ACTA, unfortunately, has failed to leverage upon networks of community workers from the Ebola response. In preparation for this intervention, we spoke to Dr. Masoka Fala in Liberia, who said it was essential to build upon these gains. Robert Kanwagi in DRC told us about demotivated and unpaid community health workers. Delivering an optimal COVID-19 response requires a worker justice and gender justice approach, given that these community workers, majority of them are women. Community health workers can be crucial pieces of the puzzle to increase uptake of health technologies, and their value cannot be underestimated. What happened in DRC cannot happen again. It cannot be denied that an element in this has been disintegrated leadership and inadequate engagement of local communities. We need to understand why COVAX's vaccine readiness tool failed to anticipate these barriers. We understand that now there is a system of red flags, and we welcome that, but there's a clear need to re-engage domestic stakeholders. And in DRC, this might be involving meaningful engagement with trusted provincial leadership. We also note emerging data about vaccine non-acceptors in DRC and how they're more likely to cite cost and distance to vaccination facilities as reasons for not accepting the vaccine. Donors must ensure flexibility within their programs to bring the vaccines to them. There are ample examples in Liberia, Sierra Leone, and Guinea where vaccine hesitancy to the experimental Ebola vaccine during the 2014 outbreak was successfully overcome. We need to quickly adapt those lessons. On the ACTA, there has been insufficient focus on financing of demand and the active engagement on citizens and communities. There needs to be investment in mass text messaging, mass media campaigns, and community outreach to tackle vaccine hesitancy, to engage individuals on community-based testing, PPE, pulse oximeters, and other tools. Countries should ensure that they budget for these under C19RM proposals. There are also deficiencies in supply chain for PPE or oxygen, etc. And the oxygen market is extremely concentrated, and there's an urgent need to explore catalytic interventions to change this. LMICs need domestically manufactured supplies, and we need to look into this. We need to tackle the imbalance of funding on the ACTA, and I appeal to donors to take these examples back to capital and urgently invest in health systems towards ending this pandemic. Thank you.
Thank you so much. Could I just ask you briefly what would be your ideal vision for how the health system connector would work with CSOs to deliver impact at the country level?
I think to start, we need the CSOs and community members and members of the government from LMICs integrated within the working groups. That's the first step to ensure democratization of knowledge. The next is we haven't really seen, there's been very few countries investing in the health workforce. And we need to find a way to make sure that the donors are not just focusing on vaccines, and also in making sure that the money comes to health systems. Thanks.
Okay, thank you. Thank you for that. With these final remarks, we're going to conclude the speeches from the panelists and open up for a discussion within the Facilitation Council. So I'd now like to hand over to Fabia, who will moderate the council discussion. Fabia.
Thank you very much, Ms. Ross. May we kindly remind those distinguished delegates and council members wishing to take the floor to please raise their virtual hand, and that speakers are given 2 minutes. I now have the pleasure in inviting the United Kingdom to be followed by Canada. Thank you, United Kingdom, you have the floor.
Great, thank you very much indeed. Just 3 really brief comments given time. The first is I'm extremely struck by Dr. Rahman's comments, which were really clear, and I will indeed take them back. I think you're absolutely right to focus on the health systems. That is something where we're in the middle of the actual acute phase of the pandemic, but we must not lose sight of the fact that the health systems themselves need significant strengthening, and that we are going to have to protect not just populations against COVID, but all the other health impacts, which actually have suffered enormously during the pandemic. And try to strengthen the systems so that, as the IPPR report will no doubt say today, we are in a better place when we come down to a next pandemic, and to cope with the other health burdens in many countries. So we really strongly welcome the health systems connectors shift to a really country-focused approach. The robust kind of national plans that we're going to need are going to be absolutely essential. And we're going to have to make the shift fairly soon from treating COVID as a crisis to COVID as an endemic disease, where we're integrating that completely into longer-term sustainable health systems. We would really welcome a discussion in this council about how the funds mobilised through ACT and partners can support a more coordinated and integrated response at a country level. That was the first point. Very briefly, a second point, just congratulations to many in ACT-A for great work done so far in terms of the tools. Many have said this, but it is remarkable work. And we are very strongly supporting the work on equitable access, as many have said. You may have all seen a G7 statement on equitable access negotiated a little earlier this week, trying to unblock not only some of the actual sharing of vaccine doses, but the other issues within COVAX, and strengthen COVAX and speed many of the issues up. So we are going to be working very closely over this next period with the Italian G20 presidency, many countries here represented, of course, ACT-Accelerator, the MDBs, civil society and industry to try to deliver on these and actually step up actual vaccine production and getting in people's arms. We are seeing so many of the barriers along the way. They can be overcome, but they do take quite intense coordination. And I think that challenge of getting the system to work, not just individual pieces, is one we're all feeling quite strongly. Thank you very much indeed, Minister Ulstein. Thank you very much indeed, all of you.
Thank you to the United Kingdom, and may we now invite Canada